Hello, my name is Sandra Hanson. I'm a specialist nurse for childhood constipation, and I successfully set up and run a childhood constipation service at my local hospital. I'm recently retired, but I'm still passionate about helping children and parents with chronic idiopathic childhood constipation. And I thought it would be a really good idea if I could, now I have some time, I can make some videos to help you support your child. Chronic childhood constipation is not something that can be managed by lifestyle changes alone. It's not something that just a simple change in diet is going to make a difference. You need to look at this with a holistic approach and not look at just lifestyle changes. So for this reason, I want to make a series of videos covering all aspects of chronic childhood constipation. So let's start with discussing Macrogols. According to the NICE guidelines, they are first-line treatment for treating childhood constipation. If used effectively in the very beginning, they can stop an acute constipation from becoming chronic. So what does a Macrogol do? Well, a Macrogol effectively adds water to the poo. There are many different brands on the market. This is an example of one. It's a powder in a sachet that you mix with the right amount of water. Every paediatric sachet should be mixed with 62.5 mils of water. You can always add more, but never less. And what it does is it makes the water molecules too large to be absorbed through the intestine wall. So effectively, what your child drinks stays in the intestine and wets the poo. The right dose is whatever keeps your child pooing easily every single day. So usually the dose is between half to 4 sachets daily, but it might need a little bit more. If this is your child's first experience of constipation, you still need to keep it up. Don't stop just because they've done a poo. Just keep it up and keep it going, because what we don't want your child to do is to get frightened of having a poo and start holding. So if this is your first time of using a Macrogol, keep it up for several weeks until your child just happily goes off to do a poo and does not have any fears or worries about it at all, and then very slowly wean off. If your child has chronic constipation, they need to take this Macrogol for a long time. At least 6 months of normal poos is the recommendation by NICE before you start to wean off the medication. What does a normal poo mean? Normal poo means they just go off and do it quite happily. If your child is still trying to prevent their poo from coming, that is not a normal poo. So you would need to keep going. Each sachet needs the amount of water. So if you are using 2 sachets, you need 125 mils of water. Okay? 4 sachets will be 250 mils of water. Do not use less, but you can always use more. You can always top it up to a bigger glass, but never use less. Make sure your child drinks as well, though, other drinks, because a Macrogol is not absorbed like normal fluids. That amount of fluids, if you give your child 4 sachets, it's 250 mils. That is 250 mils that is staying in the intestine and the rectum and wetting the poo. You must make sure that your child drinks as well. We recommend you familiarise yourself with the Bristol stool chart. It's easily found on the internet. It's a series of pictures that will give you an idea of how well the Macrogol is working. If your child is doing poos more like this, then we need a little bit more water in it. We need a more Macrogol. If your poos are coming like this, then we need a little bit less. Thank you for listening. I hope it's been really useful. I'm going to do more videos. We're going to talk about disimpaction. We're going to talk about Macrogol hacks, what to do when your child won't drink it. I want to discuss things like withholding, schooling problems, lots of many different things that cause all sorts of problems for parents and children with chronic constipation. Feel free to leave some comments that we can discuss in later videos. Anything else that you would like to see covered, and we'll do our best to see what we can do.